Welcome to our senior health video. This video will talk about the potential symptoms of high blood pressure. Have you ever noticed your heart pounding for no clear reason or felt a pressure building in your head that just won't fade away? Maybe you've had moments when your vision blurs, your chest feels tight, or you suddenly feel dizzy after standing up. Most people ignore these moments, blaming them on stress, exhaustion, or simply getting older. But what if these subtle signals were actually your body's silent cries for help? Across the United States, over 120 million adults live with high blood pressure, and nearly half of them have no idea their lives are in danger. Doctors call it the silent killer because it creeps up without warning, slowly damaging your heart, brain, kidneys, and arteries, often for years before showing any clear signs. By the time symptoms become obvious, the risk of stroke, heart attack, or kidney failure can already be dangerously high. This is the reality that too many Americans face every single day, and yet it doesn't have to end this way. The truth is, your body always tries to warn you before a crisis begins. Those tiny clues, the headaches you dismiss, the sudden dizziness, the fatigue that won't go away, they all mean something. Each one is a message from your body asking you to listen before it's too late. In this video, you'll uncover the real science-backed warning signs of high blood pressure that most people miss. You'll learn why these symptoms happen, how they connect to your heart and brain, and what immediate steps you can take to protect yourself. Stay tuned, because understanding these signs could be the difference between catching a silent threat early or facing it when it's already too late. What you learn today could literally save your life or the life of someone you love. Number 1, headaches. It begins with something familiar. You wake up with a pounding headache, the kind that feels heavy behind your eyes or tight around your temples. You tell yourself it's stress, maybe dehydration, or just a bad night's sleep. But what if that pain is not ordinary at all? What if it's your body warning you that your blood pressure is dangerously high? When blood pressure spikes, it increases the pressure inside the blood vessels of your brain. Those delicate vessels can stretch and leak, causing pain, swelling, and pressure that you feel as a throbbing headache. A study in the Journal of Headache and Pain found that people with elevated blood pressure were more likely to suffer from severe morning headaches. That's because blood pressure naturally peaks after you wake up, adding more strain to your arteries when they're already under stress. Ignoring these headaches can be risky, since they can be early signs of a potential stroke or brain damage. The good news is you can protect yourself. Check your pressure regularly, stay hydrated, avoid excess salt, and practice calm breathing when stress hits. A small change today could prevent a much larger problem tomorrow. But only knowing this sign is not enough, because the next one may leave you dizzy and off balance, and it might come without warning. Number 2, dizziness or lightheadedness. You stand up from your chair and suddenly the room tilts. The world spins for a few seconds and you have to steady yourself before moving again. That moment of dizziness or lightheadedness might seem harmless, but it can be a warning that your blood pressure is not stable. When blood pressure rises sharply, it affects blood flow to your brain. The arteries that should deliver oxygen and nutrients become narrowed, reducing circulation. The result is that familiar feeling of unsteadiness or even blacking out for a few seconds. Doctors explain that this reaction can be a sign of orthostatic hypertension, a condition where blood pressure jumps when you stand up instead of dropping slightly as it should. A study in the Journal of the American Heart Association showed that people who experience frequent dizziness when standing are more likely to have long-term blood pressure problems. These sudden shifts not only make you feel faint, but can also increase your risk of falls and mini strokes. To protect yourself, stand up slowly, drink enough water, and monitor your blood pressure during the day. Light exercise, such as walking or stretching, helps maintain healthy circulation. If dizziness happens, often talk to your doctor to adjust your lifestyle or medication. Sometimes what feels like a brief dizzy spell is actually your body's early signal to slow down and listen. But even understanding this warning is not enough, because the next symptom can blur your world literally as your eyes start to show the damage within. Number 3, blurred or double vision. One day you notice the words on your phone look blurry, or the world seems slightly out of focus. You blink thinking it's fatigue, or maybe your glasses need adjusting. But that blurred or double vision can be your body's way of telling you that high blood pressure is damaging the small blood vessels in your eyes. These vessels are incredibly delicate, and when pressure stays high for too long, they begin to harden and narrow, reducing blood flow to the retina, the part of your eye responsible for sharp, clear sight. Doctors call this condition hypertensive retinopathy, and it can lead to permanent vision loss if ignored. According to research published in the Journal of Human Hypertension, people with chronic high blood pressure showed clear signs of retinal damage long before they noticed any visual symptoms. That means by the time your vision starts to blur, the problem may already be serious. The good news is that your eyes can recover when you take action early. Get your eyes checked at least once a year, especially if you already have high blood pressure. Eat foods rich in vitamin C, omega-3s, and leafy greens which support healthy circulation. Your eyes are windows to your overall health, and sometimes they reveal what your heart is hiding. But knowing this is only the beginning, because the next symptom doesn't just affect your vision, it can leave you struggling to breathe. Number 4, shortness of breath. You climb a few steps or walk across a room and suddenly you need to catch your breath. You pause thinking maybe you are out of shape or tired. But what if that shortness of breath is your heart warning you that it is working too hard? When blood pressure stays high, your heart must push against greater resistance to move blood through your arteries. Over time, this constant strain makes the heart muscle thicken, especially in the left ventricle, a condition doctors call left ventricular hypertrophy. This thicker muscle becomes stiff and struggles to pump efficiently. As a result, fluid begins to build up in your lungs, making it harder to breathe freely. A study published in the Journal of the American Heart Association found that people suffering from hypertensive crises often reported breathlessness as one of their first warning signs. In severe cases, pressure in the lungs' blood vessels increases rapidly, causing pulmonary edema, where fluid fills the air sacs, leading to sudden suffocation if left untreated. To protect your heart and lungs, check your blood pressure regularly and maintain a heart-healthy lifestyle. Reduce sodium intake, stay active with light cardio, and practice deep breathing exercises to improve oxygen flow. Never ignore unexplained shortness of breath, especially if it happens at rest or at night. Sometimes your lungs speak before your heart gives out. But knowing this is not enough because the next symptom can strike silently in your chest, and it is one that too many people overlook until it's almost too late. Number 5, chest pain or discomfort. It often starts quietly. A small tightness in your chest, a dull ache, or a burning pressure that feels like something heavy is sitting on your ribs. You might think it is heartburn, stress, or muscle tension, but that feeling could be your heart crying out for help. When high blood pressure forces your heart to pump against stiff and narrowed arteries, the muscle begins to overwork. Over time, it thickens and loses flexibility, making it harder for oxygen-rich blood to reach the heart tissue. This lack of oxygen leads to chest discomfort, known as angina, one of the most serious warning signs that your cardiovascular system is under strain. According to the American Heart Association, people with uncontrolled hypertension have a much higher risk of developing coronary artery disease, which can trigger chest pain or even a heart attack. The constant high pressure damages the inner walls of arteries, allowing plaque to build up and block blood flow. Imagine sitting on the couch feeling a sudden sharp pressure in your chest that radiates to your arm or jaw. That moment could be your heart's last call for attention before something irreversible happens. The good news is you can prevent that scenario. Keep your blood pressure within a healthy range, eat more fiber-rich foods, limit processed fats, and manage daily stress through calm breathing or meditation. Never ignore chest pain that lasts more than a few minutes or appears during rest. Your heart works for you every second. Make sure you work to protect it too. But knowing the symptom alone is not enough because the next one may seem harmless at first glance, yet it can reveal rising pressure hidden deep inside your body. Number 6, nosebleeds. You tilt your head forward, tissue in hand, watching small drops of blood fall from your nose. It seems minor, maybe caused by dry air or allergies. But what if that unexpected nosebleed is your body's way of showing that your blood pressure is too high? The tiny vessels inside your nose are some of the most fragile in your body. When blood pressure rises sharply, it puts extra force on these delicate capillaries, making them more likely to burst or leak. While not every nosebleed means you have hypertension, frequent or hard-to-stop bleeding can be a warning that your arteries are under serious strain. Research published in JAMA Otolaryngology Head and Neck Surgery found that people with elevated blood pressure were much more likely to experience recurrent nosebleeds that required medical care. This happens because high blood pressure weakens vessel walls over time, and when pressure spikes, the smallest blood vessels, like those in your nose, are the first to give way. Imagine getting a random nosebleed while watching TV or driving to work. You stop the bleeding and move on, unaware that your heart may have just sent you an early distress signal. To protect yourself, track your blood pressure regularly, stay hydrated, and avoid excessive use of nasal sprays that dry out your sinuses. Eat foods rich in vitamin C and omega-3s to strengthen your blood vessels. If nosebleeds happen often or take a long time to stop, do not ignore them. Treat them as a sign to get your pressure checked. Sometimes the smallest drops of blood can be the first sign of something much larger happening inside. But only knowing this is not enough, because the next symptom doesn't show on the surface. It quietly drains your energy and clouds your mind. Number 7, fatigue or confusion. You wake up feeling tired even after a full night's sleep. Your body feels heavy, your thoughts foggy, and your motivation gone. Many people think it is just age or stress, but persistent fatigue and mental confusion can actually be warning signs that your blood pressure is affecting your brain and heart. When your heart struggles to push blood through tight pressured arteries, less oxygen reaches your muscles and brain. The result is constant exhaustion and difficulty focusing. According to the Cleveland Clinic, extremely high blood pressure can cause hypertensive encephalopathy, a dangerous condition where the brain swells due to excessive pressure. This leads to headaches, confusion, and in severe cases, seizures. A recent study in Hypertension Journal also found that people with uncontrolled blood pressure experience faster cognitive decline because reduced circulation slowly damages brain cells. Imagine forgetting simple words mid-conversation or feeling too tired to finish daily tasks. Your body might be begging you to slow down and listen. The good news is recovery begins with awareness. Get enough sleep, drink plenty of water, and include heart-friendly foods like salmon, spinach, and berries. Light exercise improves oxygen flow, helping your mind stay clear. If fatigue or mental fog lingers, don't ignore it. Your brain is asking for balance. But this isn't the only warning, because the next symptom can make you feel sick to your stomach before danger truly begins. Number 8, nausea or vomiting. A wave of nausea hits out of nowhere. You feel dizzy, your stomach twists, and you rush to sit down. You might think it's something you ate, but this sudden sickness can actually be a sign that your blood pressure has risen to dangerous levels. When pressure spikes rapidly, it affects the brain's control center, responsible for balance and nausea. The result is a reaction that feels like motion sickness even when you are sitting still. Doctors call this a hypertensive crisis, a situation where blood pressure climbs so high it begins to impact brain function and cause swelling. Research in the Journal of Clinical Medicine found that patients who arrived at hospitals with dangerously high blood pressure often reported nausea and vomiting before more severe symptoms appeared. It happens because the brain's blood vessels are overwhelmed, sending mixed signals that trigger sickness. Imagine eating dinner and suddenly feeling sick to your stomach while your head pounds. That could be your body shouting for help before a stroke or other emergency develops. To protect yourself, act fast when nausea appears with headache or dizziness. Check your blood pressure, drink water, and seek medical care if symptoms persist. Small steps like managing stress, avoiding salty foods, and staying hydrated can help stabilize pressure. But knowing this is not enough, because the next symptom doesn't make you sick. It makes your heart race like it's running for its life. Number 9, heart palpitations. You are sitting still, maybe watching TV or reading, when suddenly your heart starts pounding fast and hard. It feels like it is skipping beats or fluttering uncontrollably. That frightening sensation is called palpitations, and it can be your heart's way of telling you that high blood pressure is interfering with its rhythm. When blood pressure stays high, the heart must pump harder to push blood through stiff arteries. Over time, this extra strain thickens the heart's walls and disrupts the flow of electrical signals that control each beat. The result is an irregular rhythm that you can literally feel inside your chest. The American Heart Association warns that long-term hypertension is one of the biggest causes of atrial fibrillation, a dangerous heart rhythm disorder that can lead to stroke or heart failure. Studies show that patients who control their blood pressure early reduce their risk of arrhythmia dramatically. Imagine lying in bed at night feeling your heart racing even though you are calm. That is your body signaling that it is under pressure. You can help restore balance by limiting caffeine and alcohol, managing stress, and exercising gently each day. Foods rich in magnesium and potassium also support a steady heartbeat. If palpitations become frequent, check your blood pressure and speak to your doctor. Ignoring the rhythm of your heart today could silence it tomorrow. But knowing this is still not enough because the next symptom might start quietly in your ears and echo through your entire body. Number 10, tinnitus. You sit in a quiet room, yet you hear a faint ringing or buzzing sound that never stops. You look around, but no one else hears it. That noise is called tinnitus, and it can be a subtle sign that your blood pressure is too high. When blood pressure rises, it puts extra strain on the tiny blood vessels inside your inner ear. These vessels supply oxygen and nutrients to the hearing nerves, and when circulation is disturbed, your brain interprets it as sound. The result is that persistent hum or ringing that follows you everywhere. Research published in Frontiers in Neurology found that people with hypertension were far more likely to experience tinnitus than those with normal blood pressure. Some blood pressure medications, such as diuretics, can also make the ringing worse if not monitored carefully. Imagine lying in bed at night trying to fall asleep, but all you can hear is that endless ringing in your ears. That sound might be your body's way of asking for attention. The good news is that lowering your blood pressure often reduces tinnitus. Stay calm, manage stress, avoid excessive salt and caffeine, and give your body time to heal. If the ringing continues, talk to your doctor. Don't ignore what your ears are telling you, because sometimes they warn of problems your heart cannot speak. But that's not the last signal. The next one may shake your hands and reveal that your nervous system is under pressure too. Number 11, tremors or muscle shaking. You reach for a cup and notice your hand trembling slightly, even though you are not nervous or cold. The shaking stops for a while, then returns when you least expect it. This small but unsettling symptom can happen when high blood pressure overstimulates your nervous system. When your blood pressure rises, your sympathetic nervous system, the part that controls your fight or flight response, releases stress hormones like adrenaline. These hormones cause your muscles to contract faster and your hands or legs to tremble or shake without reason. A study published in the Journal of Hypertension found that adults who developed high blood pressure often showed noticeable hand tremors years before diagnosis. The constant internal pressure keeps the nerves and blood vessels on alert, making even small movements feel unstable. Imagine sitting at a table trying to drink water and realizing your hand won't stay still. It might seem minor, but it's a clear signal that your body is struggling to maintain balance. You can calm these tremors by lowering stress, getting enough rest, and reducing caffeine or alcohol. Gentle stretching and breathing exercises also help regulate nerve activity. If shaking continues, have your doctor check both your blood pressure and medications. Your hands might be shaking on the outside, but the real problem could be the silent pressure building inside. Yet this isn't the only visible sign. The next one can show up right on your face, and it reveals how your body reacts when pressure rises too high. Number 12, facial flushing. You are talking, laughing, or maybe having a drink, and suddenly your face feels warm and turns red. It fades after a few minutes, so you think it is just embarrassment or the alcohol. But frequent facial flushing can be a signal that your blood pressure is rising too high. When pressure builds inside your arteries, the tiny blood vessels near your skin expand to release the tension. This rush of blood to the face causes that visible redness and heat that many people dismiss as harmless. Doctors note that this reaction is more common among people who already have uncontrolled hypertension. A study in the Journal of Clinical Hypertension found that adults who experience facial flushing while drinking had a 42% higher risk of developing high blood pressure compared to those who did not. This happens because alcohol and stress hormones temporarily increase blood pressure and heart rate, forcing blood vessels to widen too quickly. Imagine being at dinner, taking one sip of wine, and feeling your face heat up like fire. That moment could be your body's early warning sign. To protect yourself, limit alcohol, manage stress, and drink plenty of water. Include foods rich in magnesium, potassium, and antioxidants to support vessel health. Your skin often reflects what's happening deep inside your body. Pay attention when your face flushes. It could be your body revealing what your heart is hiding. But even this is not the final warning, because the next symptom can strike suddenly and leave part of your body weak or numb. Number 13, numbness or weakness in the limbs. You reach for your phone, but your hand feels weak or numb. You try to move your arm, and for a moment it does not respond the way it should. It passes quickly, so you tell yourself it is nothing. But this sudden numbness or weakness can be a dangerous sign that your blood pressure is cutting off circulation to your brain. When pressure inside your arteries becomes too high, it damages and narrows the vessels that supply oxygen to brain tissue. This can lead to small clots or even ruptures that block blood flow, a process that can trigger a stroke without warning. The American Heart Association warns that uncontrolled high blood pressure is the leading cause of strokes in adults over 50. Even brief moments of numbness or weakness on one side of your face, arm, or leg can be early signs of a transient ischemic attack, sometimes called a mini stroke. Imagine trying to pick up a cup and watching it slip from your hand. That small moment could be your body's cry for help. To stay safe, check your blood pressure regularly, eat a balanced diet rich in greens and omega-3s, and stay active to keep blood flowing smoothly. If numbness happens, suddenly treat it as an emergency and call for help immediately. Acting fast can save your brain and your life. High blood pressure can be silent, but its effects never are. Now that you know the early signs, headaches, dizziness, vision problems, fatigue, and more, you have the power to protect yourself before it's too late. Every symptom is your body's message, a quiet warning that something inside needs care. The good news is that it's never too late to make a change. Your body can heal when you start treating it with kindness and awareness. You don't need expensive treatments or complicated routines. Start by checking your blood pressure regularly, staying hydrated, moving your body every day, and eating foods that support heart health. Choose meals rich in fruits, vegetables, and whole grains. Reduce processed foods, lower your salt intake, and make time to rest. These simple actions can make a life-changing difference. If you ever feel discouraged, remember this: even small steps can reverse years of damage. The human body is incredibly resilient when given the right care. You have the power to take control of your health today. Listen to your body, make one better choice, and keep going. Your heart, your brain, and your loved ones will thank you for it. Save this video so you can revisit these tips anytime you need a reminder. Share it with someone you care about. You might help save their life. And don't forget to subscribe for more senior health insights and food-based solutions that truly work. Every week, we bring you new science-backed ways to stay strong, independent, and full of energy. Stay hopeful, stay healthy, and join us in the next video where we reveal simple everyday foods that naturally lower blood pressure and protect your heart for years to come.